Good morning, everyone. Welcome to today's webinar. Today we're talking about tobacco retailer licensing. For those of you who aren't familiar with the acronym, TRL does not stand for Total Request Live, the MTV program. It stands for Tobacco Retailer Licensing. So you're going to be hearing that acronym a few times today. My name is Leslie Zellers. I'm the Director of Programs at Public Health Law and Policy, and I'll be facilitating today's webinar. Public Health Law and Policy is a nonprofit organization that helps communities pass laws to make the healthy choice the easy choice. In the area of tobacco control, we've helped dozens of communities limit exposure to secondhand smoke or require a license to sell tobacco products. Some of you may know us as TALC, the Technical Assistance Legal Center, which is the name of our tobacco control work here in California. Some of you may also know us as NPLAN, which is the name of our childhood obesity prevention work. Our co-sponsor for today's webinar is the Center for Tobacco Policy and Organizing, which is a project of the American Lung Association of California. The center helps communities meet their policy goals by helping them with community organizing strategies. Now, because we're lawyers, I do have a little bit of fine print. Basically, this says that we aren't providing any legal advice today. If you have any technical difficulty at any point during the webinar, please contact Scott Watkins. His email is listed above, and really the best way to reach him is by using the chat box, which I'll tell you about in just a moment. If you have any questions or comments during our webinar, please use the chat box. So why don't we take a moment to warm up the chat box, and why don't you tell us, anyone who's listening, what state you're calling in from. So if you just go ahead and enter that into the chat box and send it out, it won't be visible to everyone, but all the presenters can see your responses. So we're seeing Hawaii, California, New York, Washington, Alabama, Michigan. Wow, we have a really diverse group here. That's great. So we encourage you to use the chat box at any time during the presentation to ask questions. I also want to let you know that we're recording this webinar, and you'll receive a link to the recording after the webinar ends. So today we're going to talk about tobacco retailer licensing as well as the various plugins that can be added to a licensing law. We're also going to hear from two communities that have successfully adopted two of these plugins. As we've seen from the chat box, there are a lot of people on today's webinar who are not from California. So I want to point out a few things for our out-of-state listeners. In California, we happen to have a state law that requires a tobacco retailer license. The primary purpose of this law is to prevent tax evasion. The law was not motivated by public health concerns. So in California, we have more than 100 local communities that have passed their own local tobacco retailer licensing law. And this is in addition to the state law, and it gives local communities more control over the retailers and enforcement of tobacco control laws. Today's webinar is going to focus on these local laws. If you're listening from another state, it will depend on the law in your state whether this is something that you can adopt on the state level or on the local level or both. So if you have any questions about that, feel free to contact us after the webinar. So let's meet our presenters. Ian McLaughlin is a senior staff attorney with Public Health Law and Policy, and he works on both childhood obesity prevention issues as well as tobacco control. Jeannie Jung is the organizing coordinator for the Center for Tobacco Policy and Organizing. And Dawn Dunn has worked with the Santa Barbara County Public Health Department's Tobacco Prevention Settlement Program since 1989 and has managed the program since 1993. Catherine Mungen is our newest staff attorney at Public Health Law and Policy, and she's focusing on tobacco control, specializing in the retail environment. Justin Garrett is the policy manager for the Center for Tobacco Policy and Organizing, where he tracks and analyzes local, state, and federal tobacco control policies. Finally, Natasha Kowalski serves as the project director for the Tobacco Education Program at the Santa Cruz County Health Services Agency. Catherine Mungen is going to be our first presenter. Again, please use the chat box throughout to ask questions. At this webinar, we're going to be taking questions at 2 points. We're going to take questions midway through the webinar after half of the speakers talk, and then again at the end of the webinar. If for some reason we're not able to get to your question, please follow up with us after the webinar and we'll give you our contact information at the end. So Catherine, why don't you take it away?
Thanks, Leslie. So I'm here to provide an overview of tobacco retailer licensing. And I don't need to spend too much time on that because I think most people on the call are familiar with the basic concept. So this is really an accelerated lesson. I'm just going to touch on 3 main points. First, what is a TRL? Second, why would a community want to adopt a TRL? And finally, how can a community draft an effective TRL? So what is TRL? Well, under a tobacco retailer licensing ordinance, the government requires all businesses that sell tobacco products to obtain a license from the government in exchange for the privilege of selling those products. And licensing schemes are actually really common ways for governments to regulate all kinds of behavior that's potentially dangerous. For example, selling alcohol or owning a firearm, or even probably the most common example, driving. Most of us probably have a driver's license. So selling tobacco is really similar to some of these other activities, and it's something that the government has an interest in regulating. So the next question is, well, why would the government want to regulate the sales of tobacco? And really, first and foremost, it has to do with illegal sales to minors. Obviously, we don't want youth to have access to cigarettes. But effectively reducing their access can actually have enormous effects on public health. Of all the adults that smoke today, currently, over 80% started before they were 18. That means that most of them got hooked before they were even legally allowed to possess tobacco. And what this means to me is, to the extent that we can prevent kids from accessing tobacco while they're still minors, we can really have a strong impact on public health issues in the future. And the good news is that strong TRLs are actually really effective at preventing youth access to tobacco. The California Center for Tobacco Policy and Organizing, who we'll hear from a little bit later in this webinar, has some great data showing how effective TRL can be. This chart that you see right here has data collected from over 31 communities in California that were aggressively and actively enforcing their TRLs. And it shows you the youth sale rate before the ordinance was adopted and after. And you can see that the numbers are really dramatic. They fall from the 30s and 40s, and in some instances the 60s, all the way down to 10, 5, 4. So this just goes to show how effective a strong TRL can be at achieving those goals. But how do you draft a strong TRL, one that's actually effective at reducing youth sales? So in our experience working with communities all over California and seeing how TRLs have evolved over time, we found that TRLs that are effective share 4 common provisions. The first one is that all retailers should obtain a non-transferable license that's renewed annually. Originally, some TRL ordinances required only smoke shops or the tobacco-only stores to get licenses. But in actuality, a lot of data shows that some of the non-traditional retailers, like donut shops and delis, are the worst at checking IDs. So in order to be effective, we've really found that all tobacco retailers should obtain a license, and it should be renewed annually. The second element to an effective TRL is that the program would have a licensing fee that covers the administration and enforcement costs. The key here is really to have some source of guaranteed funding year after year. And with state government and budget problems, the easiest way to do this is really through a licensing fee. And if you think about it, it's actually the fairest way. It makes sense that the retailers who are making a profit off of the sales of tobacco products are the ones who have to bear the cost of ensuring that these products are sold in a safe way that's really conscious of our public health concerns. So this is the reason why licensing fees are still legal in California, and they're used in all other sorts of licensing schemes. The third element is this provision that violating any tobacco law is a violation of the license. So a lot of people wonder if a TRL might be redundant, because there actually are a lot of laws out there. And a lot of those laws, both state and federal laws, cover tobacco sales. So for example, there are laws here in California that restrict sales to minors, that restrict self-service displays, that prohibit the sale of individual cigarettes. And then there's the Federal Tobacco Control Act, which we often call the FDA law because it gave the FDA the authority to regulate some tobacco products. And this really touches on all of those topics. So these are a lot of laws, and they're hard to keep track of, even for lawyers. But it's really the cities and the counties who have to deal with the consequences of the retailers who violate these tobacco laws. And all of these laws have different enforcement mechanisms, and some of them actually aren't being enforced yet, for example, the FDA law. So how can a TRL help with that? Well, what a TRL does is it actually consolidates all of these laws into a uniform enforcement program, and it gives control to local government to make sure that that's enforced in the way they see fit. So one of the principal benefits of having a TRL ordinance is this provision that you can include that explicitly makes it a violation of your local license if you violate any tobacco-related law at the state, federal, or local level. So implementing a local TRL is really a way for cities and counties to go from this kind of confusing array of laws to this, an enforcement mechanism and penalty mechanism that's uniform and can be enforced uniformly across the board. All right, so that brings me to the fourth element of an effective TRL, which is really meaningful penalties. We know that even the best written law isn't going to be effective unless there are meaningful penalties attached. And for TRL, what that really means is a suspension of the license. The loss in profits from tobacco sales is what really provides the strongest incentive to comply with the law for retailers. So these are the four elements that we find make a strong TRL, one that's really effective in reducing youth sales to minors. And fortunately, all of these elements can be found in our model ordinance and the associated plugins on tobacco retailer licensing, which is on the PHLP webpage. And the model ordinance looks like this. And the great thing is this language is fully customizable so that communities can decide some of the other policy decisions, like how high should the licensing fee be, who will administer the program, who will oversee enforcement, how many inspections should be conducted per year. And there are a host of other policy decisions that communities can customize. So these are the bare minimum requirements for a community to have an effective TRL. But what if a community is concerned not just with enforcing existing laws and reducing youth access to tobacco, but what if they've identified other tobacco-related issues that they want to enforce through TRL? Well, I'm going to turn it over to my colleague, Ian McLaughlin, and he's going to talk about how some communities in California are approaching that task. Ian?
Thanks very much, Catherine, and good morning to everybody out there. That's a great overview, an accelerated lesson about TRL 101. But as Catherine mentioned, we're really going to focus on what we call the plugins today for the remainder of this webinar. What do we mean by plugin? Well, it's simply that these are different policy solutions that address specific tobacco control issues that can be included or plugged into a licensing ordinance. Essentially, the licensing ordinance is the mechanism by which these various policies can be implemented and enforced. To extend the metaphor a bit, you see a picture of a power strip on the screen here. And think of the model licensing ordinance that Catherine just described as a power strip that can prevent an illegal surge of sales to minors. But also, the licensing ordinance is like a power strip in other ways, in that you can operationalize or run many different devices or policies through a single power source using this power strip. In terms of TRL, what this means is that the power source is the government's power to regulate businesses through licensing. And through that one power source, you can plug in a lot of different devices or policies that can be implemented. In today's webinar, we're going to talk about a variety of plugins, and they fall into two main categories. One is eligibility plugins, and the second category are requirements or prohibitions. These are really the two major categories of plugins that we've developed so far at Public Health Law and Policy. The eligibility plugins really focus on who can sell tobacco and where they can sell tobacco in the community. That is, what kinds of businesses are eligible to get a license, and what businesses in certain areas of the community are eligible to get a license to sell or not eligible to get a license to sell. The requirements and prohibitions are just that. They are additional conditions that can be placed on the licensees that must be met in order to keep their tobacco license. At the second half of this webinar, Catherine is going to talk about a variety of different requirements and prohibitions that can be imposed on tobacco licenses. But right now I just want to make a very basic point, is that we're talking about a tobacco license, so all of the penalties really have to relate to the tobacco license. The meaningful penalties that Catherine talked about, suspension or revocation of the license, that really has to tie into the tobacco license. So even though there's a lot of different conditions that you can put on the license, such as drug paraphernalia conditions or something else that Catherine will talk about, it really has to be enforced through the tobacco license itself. A lot of people on the call, I think, are very familiar with this checklist. This is the checklist that summarizes all of the main provisions that are in our model licensing ordinance that Catherine showed on the screen. But I want to show the bottom half of this checklist right now, which I've blown up. And this lists all of the plug-in policy provisions that we have developed so far at Public Health Law and Policy. There are 14 in existence, and we are currently about to release our 15th as well. And all of these are also summarized in a new fact sheet that we've just recently put on our website this week. And this is a short document that summarizes what each of the plugins that we have developed does, how they work, and what the rationale behind them does. Since we have developed the model plugins, for each of the plugins that we talk about, there is model language on our website separately for each one of them. I do also want to say that the plugins that we have developed are not the entire universe of plugins. They are the plugins we have prioritized to develop model language for, and like I said, there's going to be 15 soon. But there's any number of different policies that can be plugged into your model licensing ordinance, and so by no means are the ones that we've developed so far the entire universe. We're always looking for more ideas. So with that, that's a very basic overview of what we mean by the plugins and what's available. And now let's dive into our first category of plugins, which are the eligibility plugins, focusing on who can sell tobacco and where can they sell tobacco in the community. This is one that I think is vitally important, and it's really a good way to use licensing law to control the retail landscape for tobacco sales in your community. And the first thing that I want to talk about is a very popular concept these days, and that is that tobacco should not be sold near schools or other areas where youth congregate. And to put that in place through a licensing ordinance, it would simply say that businesses that operate near schools or youth-populated areas are not eligible to obtain a license. Catherine talked about how the overwhelming majority of smokers, adult smokers, started before they were 18, so it makes a lot of sense not to unduly expose our youth to tobacco, because there's a good chance that if they make it to age 18 without taking up the habit, they may never take it up at all. Now, the data on whether or not, what the impact will be on limiting retail sales near schools and youth-populated areas, I don't think is conclusive yet. There's not enough data to show conclusively that if we eliminate sales near schools and youth-populated areas, it will have a dramatic effect on smoking prevalence. But not only does it make good sense, but there is a stronger body of evidence that youth are particularly sensitive to tobacco and alcohol advertising. You can see here, this is a school zone, and the entire fence along this business is riddled with alcohol and tobacco ads. And the evidence is very strong that children are particularly susceptible to that kind of advertising. It's very difficult to just create a law or a policy that does something specifically about advertising, however. But I think that a policy that limits where tobacco can be sold will have a tremendous effect on advertising as well, because even though the First Amendment protects a lot of different kinds of commercial speech, it does not protect false or misleading speech. And so if a business is not able or authorized by the government to sell a certain product like tobacco, it also cannot advertise for those products if it would be false or misleading for the public. So not only does a policy limiting sales near schools or youth-populated areas make a lot of sense viscerally for us, it also makes a lot of sense in an effort to reduce the amount of advertising that children will be exposed to on their way to and from where they go typically during the day. How is this put in place via a licensing ordinance? Well, very simply, a lot of the communities in California now have mapped out where all the schools are in their communities, and the idea is basically just to create a buffer zone around those schools and say that in the buffer zone that's created here, it's in orange, it will not be legal to sell tobacco in those areas. It's a very simple concept, and there are many different ways to map what kinds of areas you want to create for buffer zones. This is one example, but there are a number of ways that you can do this. But the idea is the same, that the buffer zone is where there's no licenses allowed. A related eligibility policy is to prohibit the issuance of tobacco retail licenses in certain zones of the city. Almost every community in the nation, and certainly in California, is divided into zones for commercial uses, industrial uses, residential uses, and so forth. One of our plugins that we have model language for says that there can be no licenses issued in residential zones. You could certainly have other zones where you did not want to allow licenses to be issued, or on the flip side of that, you could say that only certain zones of the city were eligible to have tobacco retailers at all, maybe industrial zones or something like that. Using existing zoning codes is an effective way to control where these businesses will locate, because every city, every community has zoning in place already, so you can tap into that existing infrastructure. I will note that I was looking at a recent study that was published, I think, last year in the American Journal of Public Health that did show that the residential proximity to tobacco outlets did have influenced smoking cessation. So cessation efforts were much more difficult when people lived near where tobacco could be sold. So not allowing tobacco to be sold in residential zones or maybe even near residential zones can have a positive effect on cessation. A third related policy would be to limit licenses by population and density. That is, tobacco retailers cannot be too close to one another, and there can't be too many per the population of the community where you live. This is a map that I think a lot of folks on the call have seen before because I've used it numerous times. I find it very compelling. It was prepared by the San Francisco Department of Public Health, and the larger gray circles show buffer zones around all of the schools in the city and county of San Francisco. And the smaller red and green dots are the existing tobacco retailers. The green dots are those that are not within a buffer zone, so would still be allowed to operate if this was a policy. And the red dots would all be eliminated if there was not any sales within the buffer zones around the schools, the gray areas. This policy was not put into place, but it shows how many retailers would be affected. It also shows a couple of other things. It shows the overall density of retailers in the city and county of San Francisco, and it also shows where they're clustered. The upper right-hand portion and right below it are some of the lower income areas of the city and county. So there's a definite equity issue about whether or not it's fair to allow retailers to congregate in those areas. So to do this through a license, it would be another simple plugin that well, it's not exactly simple, but it's simple in concept. We have model language for it, and it would basically say that no licenses can be issued to tobacco retailers that are too close to one another, and there is also should be a cap based on the overall population of the community you're operating in, whether it's one retailer for 2,500 residents or some other metric. I think at the very least, we've been talking this over at Public Health Law and Policy, and what we think is a good idea is that any new licensing ordinance that goes into effect should, at the very least, cap the number of retailers that are in existence where it is, so that that number does not increase, but rather at least stays the same and slowly dwindles down via attrition. So those are just some ideas about limiting where tobacco can be sold in the community, and I just very briefly, I'm running out of time, but I'd like to mention a couple of plugins that relate to who can sell tobacco in the community. We have a model plugin that says no licenses can be issued for significant tobacco retailers, such as smoke shops, smoke-only shops. Conversely, you could also, a policy that's been talked about, say that only tobacco shops or significant tobacco retailers are eligible to get a license. You can use licensing to effectuate that policy. Finally, you can also use licensing to prohibit the sale of tobacco products in specific venues. This is sort of the before shot of a pharmacy, and I think everybody is also familiar with the pharmacy ban that was began in San Francisco and has now spread to some other communities in California and also across the nation as well. This is the before shot showing tobacco in a pharmacy, and this is really the after shot. This is a real shot taken by our colleague Bob Gordon from the LGBT Partnership in San Francisco of his corner pharmacy the minute after the pharmacy sales ban went into effect and all the pharmacies, all the tobacco is off the shelves. So pharmacies are getting a lot of attention about limiting sales through licensing, but as I said earlier, that's not the only potential limitation through licensing. If there's other venues that make sense to limit sales in, then you could also use licensing to effectuate that. So with that, I will turn it over to Jeannie Jung from the Center for Tobacco Policy and Organizing, who will talk a little bit about what their polling data shows. Jeannie?
Thanks, Ian, for that legal overview on eligibility. Now I will go into the Center's poll results and give our perspective on how you can implement the plugins into your campaign, as well as where these policies have been passed. So the Center has been doing scientific public opinion surveys on tobacco issues for nearly 9 years. Our first polls were in 2003 when we surveyed Los Angeles voters on smoke-free housing and Stockton voters on smoke-free entryways. And since then, we have polled all over the state, including rural areas, and on topics such as secondhand smoke and tobacco retail licensing. Our latest poll is on plugins in the retail environment. We polled on several different plugins, some of which you will hear about today. You can learn more about our poll and detailed results at our website. In this particular poll, we conducted 600 surveys statewide in English and in Spanish. We also did some oversampling in Los Angeles and Santa Clara counties as well, and you can visit our website to learn more about these results. Today, we will only be covering the statewide results. So to give you some background, there are over 100 strong or nearly strong TRL ordinances across California. These ordinances have provided the legal infrastructure for further regulation of tobacco products, regulation of tobacco sales. The cities that have adopted TRL demonstrated the political will, and now we're beginning to see a third wave of TRL ordinances. And I apologize, the slides were lagging a little bit, but they should be moving now. Here are the Center's resources on the tobacco retail licensing matrix. So now I want to go into the 3 waves of tobacco retail licensing. The first wave was during the 1990s when several dozen cities and counties passed weak ordinances with insufficient fees to fund enforcement. After the year 2000, cities and counties began passing strong ordinances, most using a fee to fund enforcement and a few utilizing other reliable funding sources. So now the third wave is beginning as cities are plugging in new restrictions into their TRL ordinance. The thing that is interesting about some of these plugins is that they target specific types of stores. For example, stores within 500 feet of schools. So you can do a youth purchase survey and see if certain categories of stores sell at a higher rate than other types of stores. For example, a 2004 survey showed that 33% of tobacco sales to minors in Los Angeles occurred within 1,000 feet of a school. This kind of information can lead people to support a targeted plug-in ordinance like requiring tobacco retailers to be at least 500 feet away from schools or 500 feet apart. So speaking of which, when we polled on this plugin, we found that 57% of those surveyed support a density policy that would require stores to sell tobacco products to be at least 500 feet apart, while 38% suppose such a policy. To demonstrate the need for this policy in your community, you can assign your youth to work on a mapping project that shows the number of retailers in their community. Maps are a powerful tool that you can bring to presentations and city council meetings to visually show the sheer number of retailers in the city. You can also create infographics that demonstrate the number of retailers per resident. Some people don't realize how dense the tobacco retailers are relative to a community, so these are good examples to highlight the problem and to have the city make that issue a priority. In particular, the density of tobacco retailers is sometimes a problem in some parts of the community, worse in some areas than others, often in low-income areas. This might get you to connect with residents in that part of town or with organizations that represent that part of the community. Make this a social justice issue. Also, density of retailers is an issue that alcohol coalitions have worked on, so there might be a way to connect with them there. For communities that have passed this particular plugin, there have been a few in California that have done it through the TRL ordinance, including Santa Clara County. Other communities, such as Union City, went through a conditional use permit. For tobacco sales near schools, we pulled on a couple of issues for this topic. When it came to prohibiting tobacco sales within 1,000 feet of schools, 73% were in support, while only 25% were opposed. Of the policies that we're talking about on the call here today, this was the plugin that got the most support in the poll. A big issue that comes up with tobacco sales near schools is what to do about the retailers that already exist in the community near the schools. Oftentimes, city councils feel like they need to grandfather in those existing retailers because they are concerned about putting a retailer out of business. Interestingly, the public does not feel this way. When polled about tobacco retailers currently within 1,000 feet of schools, only 35% felt that stores should be grandfathered, while 57% said that stores should no longer be allowed to sell tobacco. So how do you make this a part of your campaign? So this is where we hear anecdotally that a lot of youth are getting their cigarettes. The store across the street from the school, at lunch, on the way home from school. So look at your YPS and see if the rates of sales are higher in these types of stores. This plugin is a great way to involve groups such as the PTA, youth groups of schools, teachers, and principals into your campaign. Use the support for moving retailers away from schools as a reason to pass licensing. In addition, our poll indicates that the strongest arguments for passing policies are those that describe the policy as reducing teen smoking, helping teens to not start smoking, etc. This policy directly impacts schools and teens, and your coalition can make a compelling argument for the City Council to include this component in the licensing ordinance. This is another policy where doing maps or having your youth coalition do a community survey would be good. The youth can show City Council members a very compelling visual that links sales rates and retailer proximity to the very schools that they go to. I want to take a little bit of time now to talk about an organization called the Neighborhood Market Association and their influence on our tobacco control work. This past March, the West Hollywood City Council passed an ordinance which prohibited any retailer from opening a new tobacco retail store within 600 feet of schools. However, it grandfathered in 5 existing retailers currently located within 600 feet of schools and allowed them to transfer their tobacco business to new owners forever. This disappointing result was one of the first introductions of local tobacco control advocates to the power of the Neighborhood Market Association. This is a revitalized tobacco industry-funded front group that has thrown a wrench into our tobacco-making policies in several communities around the state. As we learned, the NMA was way ahead of us from the beginning. They knew that West Hollywood was considering an ordinance, and they were busy lobbying City Council to grandfather existing retailers and allow them to transfer their store to someone else before we made our first contact. Our belated efforts to educate City Council members seemed to have convinced them to reconsider, but ultimately they worked behind the scenes to recruit the chamber and a local retailer affected by the policy, and they put pressure on the council members to again include the transferability clause. The final vote affirmed their lobbying position. The takeaway point is to be prepared and don't let the NMA sneak into your community. stay in close touch with your local officials and be prepared to fight back if and when the Neighborhood Market Association comes to a neighborhood near you. So there have been over 24 cities and counties statewide that have restricted the sale of tobacco near schools. Some of them have done it as a standalone ordinance, but a handful of them have done it through their TRL ordinance, such as Santa Clara and Santa Barbara counties, South Pasadena, Riverbank, and Calabasas. To learn more, you can head to our website and check out our new document called The Matrix of Local Ordinances Restricting Tobacco Retailers Within a Certain Distance of Schools, which contains information about this plugin. It includes details on the type of ordinance adopted, such the distance requirement from schools, whether it applies to all retailers or just significant retailers, and other details. We don't have the poll results for the next two plugins, which are no new significant tobacco retailers are banning sales in pharmacies, but we wanted to mention them both briefly. So for no new significant tobacco retailers, this is a relatively new plugin, and to our knowledge, no cities have done this through their TRL ordinance. However, this type of policy speaks to communities who are trying to keep the neighborhood family-friendly. They don't mind having some stores in their community who sell tobacco, but the idea of having a store that is solely selling tobacco may not be the type of business they want in their community. This would be a good plugin to consider if you find in your YPS that these types of stores sell more to minors than others. But if not, maybe this isn't a huge issue to focus on at the moment. So Ian has already mentioned a little bit about prohibiting tobacco sales in pharmacies. So other cities that have passed this include Boston, Richmond, and Santa Clara County in the Bay Area. This is a very tough plugin, and it will pose many legal challenges. If you decide to embark on a tobacco-free pharmacy campaign, there are a number of things you can do. For example, there are very many independent pharmacies that have made the decision to go tobacco-free, so be sure to seek them out when recruiting support for your campaign. You can also do surveys of pharmacy owners and work with pharmacy students at your local college. The other question is whether when you did your YPS, if the sales rate to minors were higher in pharmacies than other stores. This would give you a compelling reason to include this plugin. In addition, try to divert negative comments that relate to business. For example, this legislation is purely a symbolic gesture that will result in the loss of jobs, and change it into positive points, such as pharmacies are a place where people go to get healthy. So now here is Dawn Dunn with the Santa Barbara County Public Health Department to talk more about the county's experience with the Sales Near Schools plugin.
Hi everyone, and I'm going to talk to you about a unique set of circumstances that occurred in our county, except right now I'm not advancing the slide. So, oh, there we go. Sorry. Technical difficulties. We were in the second wave of what I would call at the time effective ordinances in our in the community, but fairly quickly they became not as strong. So in 2001, our county unanimously adopted a tobacco retailer licensing ordinance, and I should say that we have typically a divided board, and so it was quite surprising to us to get that unanimous vote. We actively implemented that law for the county areas, which had 76 stores, and in one of our cities that had just incorporated and sort of got this law by default. We suspended licenses of about 35 retailers over a 5-year period, from anywhere from, most of those were between 10 and 30 days. We did have one 45-day suspension. And we did find that repeat offenses did not occur as frequently, but there was not a consistent drop for our minors. In retrospect, and as years went on, we had a letter of warning. I don't recommend them. We were among very few who had that. We had a very low cost for the license, and we were able to use our master settlement money to offset that. But in the event that that went away, this law would have been fairly null and void. And we didn't really feel we had enough stings or the power to do more undercover buys when needed. Our political climate was not favorable to amend that law, and we had this unique partnership emerge, and as I go, you can try and decide who was the alien and who was the human. It was either the Board of Supervisor or me, so I think we traded places at times. We had never, ever had the benefit of working so closely with an elected official in any of our communities. And we're fairly trusted program within our health department. But the supervisor approached public health department leadership, who turfed him to me, and a state senator had tried to pass a law at the state level limiting tobacco access near schools, and it failed. He sent a letter to elected officials statewide, and for political reasons, this particular county supervisor wanted to do this, thought it would be a singular ordinance or approach, and really didn't understand tobacco control. He's always been a supporter, and really didn't have any interest in going beyond this little brush of the schools issue. I want you to know that I had to push back in some cases against my staff and my department in saying that we needed to really work with our supervisor and his staff to try and help him understand why a comprehensive approach and making this TRL law we had be the vehicle or the plug-in, as it were, the power strip for this type of policy at the local level. And it turned into this amazing partnership. We were pretty much on a speaking circuit for about 9 months. And his power obviously opened a lot of doors. The new approach that we were talking about was creating these tobacco-free zones. You've heard a lot about it, and so I won't go into this except to say at great detail that this distance of 1,000 feet is what we wound up arriving at. We went out to talk to school officials and law enforcement folks, agency folks, and community groups to get their buy-in for the concept and how far away we should go from schools. This does include both public and private schools, and we basically made the argument that you've heard a lot about is using this TRL ordinance as the way to control density of retailers. Some of the things that helped us be successful were, we had a long history of these kind of buys. We had great graphics. We relied on the Technical Assistance Legal Center's model ordinance, our history with the legal precedents for these kinds of policies, and other communities. And that was really, really important because that'll be a question you get all the time, and I've seen it pop up on the chats. Is this legal? We mapped schools, and I'll show you a map quickly. I'm going to show you a couple of these tools that we used without going into great detail, but what I think is interesting, we had maps for every community. We eventually had maps by supervisorial district. They were lovely, and we updated them with new data. In the long run, when we got to the board, my supervisor decided these would confuse the Board of Supervisors. So they were useful, but they didn't wind up driving the argument. I did not include an image of our fee study. I will tell you that a certified fee study was done by our fiscal department and signed off by the Auditor Controller's Office, and it has proved to be invaluable. We can get that to you, but I thought it would be very hard to look at on these slides. Many other Q&As and fact sheets were developed, and they become really useful just to keep this kind of complex topic very simple. So this is just an example of a 3-year graph. There were sub-details shown. This is 3 years of data throughout our county. Most of you sort of know how to do this kind of graphing. Oops, I skipped a slide, excuse me. This was an image of a map in a particular city, and it showed a 500 perimeter, the schools, a 1,000-foot perimeter, and superimposed on that were some details about the sales and who was selling more and less. So we did not use youth to map this. We used a GIS person. We no longer have that person at the county. So, the economic condition has been alluded to in these slides, in the questions as well. It was definitely a factor. We also obviously looked at, there was a column here that showed 5,000 feet. We eventually got rid of it because people lit on the 1,000-foot perimeter. And we showed people, we were mainly concerned with the unincorporated area. But one of the things that I heard or saw was about rural. Look at Buellton, for example. That's, it has an industrial section. I wouldn't say it's completely rural, or Guadalupe is very rural. All their stores aren't really near. So if you look at the second to the right column, if you have no stores near a school, no matter what your sales rate is, even if it's really high, it's going to be 0 in the right-hand column. So again, the data is important, but it isn't the whole story. We use the arguments you heard. Now, you're going to have a hard time seeing this. Again, it can be provided for you, but what we did is compared our 2001 ordinance to our 2010 ordinance, and some of the stronger provisions in this ordinance, and the most impressive things were we went from a $30 fee to a graduated increased fee based on the fee study. It's $250 a year for the first 2 years, of which, well, I won't give you those details, but $435 is what it cost us. And that will happen in 2013. All our existing retailers were grandfathered in, and although something is legal, it may not be politically viable. We felt that the pushback on that would have been too tough to sell, and we knew this was a fairly new concept. We wanted to extend our look-back period. We wanted to get rid of our letter of warning. We wanted to make our suspension stronger. Another unique feature, and it wasn't new to us. I forget who we stole it from, but if you use the center's matrix, you'll see that what we did is 30-day suspension for the first violation in the new ordinance. They can negotiate it down to a 15-day suspension, but they have to pay us $1,000, and they have to admit that the violation took place. There's a few other provisions that go along with licensing and some of the problems we had. In wrapping up, we have 4 other communities considering this policy. The thing about generating revenue is we're not in this for the money, unlike the other side. We are in it to make sure that our kids are safe. But it's been interesting to note that, you know, this $250 or $435 fee seemed like it would be way too much, and yet 7, if you look at the last bullet, of the 11 suspensions that happened out of our 2011 first round of buys have paid us $1,000 to cut their suspension in half, which shows you how much. We didn't have the drop in sales. We really hope that we join that list of that our policies are effective. Last part for me would be just our lessons learned. You know, make sure that you understand this issue or bring along people who do. Be an expert and go for it. You know, you are the tobacco control advocate, and that's what you should do. Make relationships with law enforcement and the district attorney. You're going to need them. We got great support there. Use all the resources like I talked about. Our fee study gave us great cover because the day that our law went in, got the second vote was the day that Prop 26 was passed in California, saying we couldn't enact fees and such. We talked about mapping and tracking. I would add some of the other, like libraries and other youth places, youth congregate. I can't stress this enough. We're government agencies and legal agencies in some cases, and we talk in a speak that does not work for these retailers. Think about who's working in these stores. Think about language, multi-ethnicity, and keep it real simple. I would beg that any of you who have an ordinance, however weak or strong, work to enforce it. And lastly, you got to keep good records, and we're on our 3rd iteration of a database. But it's all been good, and we really, really hope to be on that next round of effective TRL policies with sales. Thank you, and I'm going to turn it over. Oh, it's a Q&A period.
Thank you so much, Dawn. That was great. And I want to thank all of our speakers. That was a lot of really valuable information. So we're going to pause here and take a few questions. Just in case you haven't already figured this out, unfortunately not all the participants are able to see the questions, but we are getting them here as presenters. So I want to direct the first question to Ian. There was a question about how to deal with the rural and frontier areas where stores are all in close proximity to schools. And Ian, please feel free to involve any of your co-presenters in answering this question.
Well, thanks, Leslie. Dawn might have something specific to the rural communities that she highlighted, but I'll just say that there really is, 1,000 feet is not a magic number. really it's part of a larger point, and the point really is that you can use your licensing ordinance to shape the retail environment in a way that makes sense for your community. As public health professionals, we think that it makes a lot of sense to limit sales near schools, but if that's not viable in a community for political reasons or policy reasons, then there's other ways to use licensing to shape the retail environment in the community. The real point is that licensing can be used to enforce those policies and to implement them, and to do so in a way that makes sense where you are. And if it's not sales within 1,000 feet of schools, there might be other areas, or at least some discrete areas, where you think that sales should not occur. So to use it and create the law that makes sense.
Thanks so much, Ian. So one of the questions that came in for Jeannie was about, do you have more details about how to effectively have youth work on a mapping project? For instance, a training course, a checklist that would ensure that the data collection is reliable.
Sure, I'll be happy to take a stab at that. So I know that in a lot of communities there isn't access to fancy software such as the GIS mapping. So you can just really treat this as a great project for your youth coalition and be really hands-on about it. Use big poster boards, color code the schools, color code the retailers. This is really just something that the kids can be creative with. I understand there may be some concern about perhaps not outing any particular retailer that sold within in that community. So I think that's something you want to check with in terms of whether you want to identify the stores. But I think just letting the youth be creative and letting them run with it is important. And when they do present it, it shows that it's their work and it's not something that that you kind of did for them so that they could present. Thank you.
Great. Thanks, Jeannie. Why don't we take one more question for Ian before we move to the next speaker. There was a question about what are the administrative costs that should be considered in the licensing ordinance.
The administrative costs in the licensing ordinance, Leslie, is that?
Correct, yeah.
Well, that's a very interesting issue now, and this is an answer that is certainly California specific, I would say. When Catherine was talking about having a fee that covers all of the costs of enforcing and implementing your ordinance, that's very important to have some sustained source of funding. And in California, Don alluded to the fact that we had a ballot initiative last year, Proposition 26, that really limited what kinds of fees you could charge. The good news is that local governments still have the ability to charge fees to cover all of the administrative implementation and enforcement costs for these licensing ordinances. So you should think really broadly about what those are. And one of the things we talk to communities about right away when they're considering licensing is to sit down with us or with the other government agencies, or preferably both, and map out what is going to have to happen to make this work. And there's a lot of moving parts in agencies, from intaking applications to creating the licenses to issuing the licenses to doing education and outreach for retailers. There's a wide variety of different elements that go into administration. So think broadly about it. And Don mentioned also the revenue calculator that they used, and that's actually a product that we have a model for as well as public health law and policy that's on our website that details all of the discrete aspects of administering and enforcing the ordinance and helps communities calculate what those will cost.
Thanks so much. Well, why don't we move on now? We actually have a little bit more material to cover, so we're going to hear next from Catherine Mungen, and then at the end of the webinar we will have another opportunity for questions. So we are collecting all of your questions, and we will get to as many as we can. Catherine?
Thanks, Leslie. Okay, so that first set of plugins that we all heard about were really about who's eligible to get a license. Now these set of plugins, they're really about once you have a license, what are the other conditions or what are the other rules that you have to follow in order to keep that license? And I just want to say before I start that I know some people have asked about, what's the difference between doing some of these things between a standalone ordinance or through zoning or through some other kind of mechanism. And one of the great benefits to working within the framework of TRL is that you can really use these through this self-financed enforcement mechanism that TRL has set up. So to illustrate this a little, let's look at our first example of a plugin. This is violating state laws prohibiting sales of drug paraphernalia would constitute a violation of the ordinance. So PHLP has actually gotten a lot of inspiration for many of its plugins from people in the field. And this drug paraphernalia plugin is an example. This photo was actually sent to us by the Oakland Police Department. And they were really concerned about corner stores that were selling drug paraphernalia and calling it something else. They were calling it a tobacco pipe or tobacco paper, but it was being used for drugs as far as the police department knew. So we looked into state law and found that there was already a lot of good law about drug paraphernalia, and it wasn't necessarily being enforced, at least not in the communities that were most concerned with it. So under this provision, if a retailer is found to have violated the California state law regarding drug paraphernalia or controlled substances, then that retailer is also in violation of their tobacco retailer license. And all the penalties of the tobacco retailer license, including a license suspension, would apply. So again, this is just another example of allowing a community to use that existing enforcement mechanism within the TRL to look at tobacco-related laws and enforce them in the way that they see fit and really give more power to the community. Here's a more recent example of another plug-in provision that was drafted at the request of a community after they identified a specific need. So what you see here on the left are single cigarettes. And as we all know, these are actually illegal. You can't break apart a pack of cigarettes and sell them individually. But here on the right we have single cigars. And you can see they come in a lot of flavors, and they're actually packaged to be sold individually. They're sold between, from 50 cents to $1. And I don't know if many of you are familiar with these. I wasn't before I got into this field, but really little cigar at least, which for example Swisher Sweets, Black and Milds are common brands. They were manufactured decades ago to really be as close to cigarettes as possible and without meeting the legal definition, because they didn't want to be subject to any of these increasing regulations that cigarettes were subject to. And unfortunately for the public health community, they've been pretty successful at this. So as you can see, even though it is illegal to sell cigarettes individually, little cigars, which pretty much look the same and do similar things, as well as cigarillos and full-size cigars, can be sold in this fashion. So this picture right here was actually sent to us by some coalition members in LA County, and you can see in the back there's a collection of Black and Milds, and those little cigars wrapped in pink foil, they're actually fruit flavored or candy flavored. You can buy grape flavored single cigars for about 50 cents, and they're really aggressively marketed to young adults, communities of color, low-income communities, and the price really makes them more accessible to kids and youth than a pack of cigarettes might be. So this is the issue that the community in LA County wanted to stop, and we worked with them to draft a plug-in provision that would prohibit the sale of single cigars. And again, like our model language, this is customizable, so you could prohibit the sale of small packages of little cigars or single cigars. And basically it allows the community to prevent these things from being sold and address this public health concern. So the next example I have is violating storefront sign laws. So this plugin requires retailers to follow all of the sign laws as a condition of maintaining their TRL. And this includes all sign laws regarding exterior storefront, window, or door signage. So as an example, California has a law that requires all liquor stores to have no more than 33% of window space covered by a sign of any kind. And this is for general public health and safety so that police officers can look in and really do their jobs. And if it's plastered with Marlboro signs and things like that, it's hard to see in the stores and make sure that laws are being followed and there's nothing going on. So really, because a significant percentage of the signs at tobacco retail locations are likely to be tobacco retail or likely to be related to tobacco, as you can see in these pictures right here, this really has a large, even though it's an indirect effect, it has a large impact on tobacco advertising. The next example of an additional prohibition or requirement is violating a tobacco age of purchase law would be a license violation. So under this plugin, if a tobacco retailer is found to have violated any age of purchase law, so for example, selling alcohol illegally to a minor or selling a lottery ticket to a minor, then the retailer's license could be revoked. And the basic idea here is that if a retailer is caught illegally selling some other controlled substance to a minor, then it can't be trusted to abide by the law protecting youth from sales. So my last example here is lookalike products. So this is a prohibition on the sale of tobacco lookalike products. And this plugin really prohibits the sale of all these products like candy cigarettes, bubblegum cigars, Big League Chew, and because these are for the most part food items, but they're packaged and marketed to kids, and they resemble tobacco products. And what a lot of studies have found is that playing with candy cigarettes or Big League Chew actually desensitizes children to the harm of tobacco and smoking and other tobacco use. And it can also really train them to respond to tobacco advertising before they're legally able to possess tobacco products. So tobacco lookalike products aren't covered by FDA law, but they're actually illegal in several other countries like the UK, Canada, and Australia. And this gives local communities an opportunity to address this issue in their own city or county, or even at the state level. But putting it into a TRL, again, really allows you to use that existing enforcement mechanism to do inspections and enforce the law. So these requirements and prohibitions are all available in model language, and you can see them on the checklist here in the right-hand column. And again, as Ian said, we have model language for each of these requirements and prohibitions that can be customized for the communities who are interested. And I just wanted to add that the single cigar prohibition is something that we don't have available on our website right now, but we do have model language. So if you are interested in learning more about that, we'd be happy to send you information or talk with you. And I'm sure Leslie at the end is going to have information on how to contact us here at PHLP. So with that, I'm going to turn it over to Justin Garrett from the Center, who is going to talk about some of the polling results and campaign strategies along with this set of plugins. Justin?
Justin, you might be on mute. Justin, are you there? Let's see. Janie, are you familiar with Justin's presentation?
I'm sure I can give a stab at it. Just give me 1 second.
Justin, if you could maybe in the chat box identify if you're having some technical issues. So we can also switch the order here and go to Natasha while we figure out. Okay, so Justin's trying to talk, and apparently we can't hear him. No, Justin, we still can't hear you. So why don't we do that? Natasha, would you be ready to go ahead?
Sure, but you have to unmute me.
Yeah, okay, so if the operator could unmute Natasha, and then I'm going to bring up her slides.
And her line is unmuted.
Great.
Would you like me to go now?
Yeah. We're just waiting for your slides to sync.
Okay.
Why don't you go ahead and control that, Natasha, so not all of us are,
So hi, my name is Natasha Kowalski. I'm with Santa Cruz County, and I'm going to talk today about how a plug-in created momentum for tobacco retail licensing in our county. Just to give you a little bit of history, our coalition, I don't think my slides are forwarding, but I'll continue anyways. Our coalition had been struggling for 7 years to generate some interest in TRL. And the coalition increased their efforts in 2008 and repeated their youth access survey, which showed that 17% of the stores sold. And the media wrote a story, but we still weren't able to get a meeting with any of the elected officials. And the main reason that we heard was that it was a bad economy and a bad time to be doing this. But then a seemingly unrelated event helped lead to TRL adoption. And what happened was in the March of 2010, a coalition member noticed that discount cigarette stores in Watsonville were selling illegal knives, brass knuckles, and drug paraphernalia. That coalition member then told about the store to the Alcohol and Drug Commission. The commissioners were so upset that they visited the store themselves, and they used their local connections to get the police to immediately investigate. And the police went into the store saying that they were doing a decoy operation to see if the stores would sell to minors. And the stores did sell the cigarettes to the minors, as well as meth pipes, switchblade knife that was illegal, and several other disturbing items. The media just loved this story, and the several newspaper articles and TV stations showed pictures of the weapons next to the cigarette store name, and they ran this quote here that said, "Cartons of smoke share shelf space with soft pellet guns that replicate more deadly assault weapons." And they interviewed several prominent members of the community, including a city council member. And I'm sorry, I'm having trouble with my slides here.
Yeah, I'll go ahead and advance them for you. Just let me know.
Okay. So a city council member was quoted as saying, "This is really unfortunate because we have a lot of stabbings in Watsonville. These businesses need a lot more scrutiny. This is shocking and outrageous." So what had happened over the last year in Watsonville was that gang violence had escalated, and a lot of the violence was stabbings. So this council member pledged to put this issue on the agenda. And can you advance the next slide for me? Other prominent members of the community were also quoted in the newspaper. This planning commissioner was actually very influential in the community, and she had this to say: "The array of knives blows you out of the water, some 12 inches or longer. You begin to wonder about stores like this, carrying a message that would be viewed by alarm in our community." And this commissioner had spent a lot of time putting regulations in place to regulate pawn shops and tattoo parlors, but she noted that cigarette stores appear to be unregulated. And then the police chief was also quoted in the newspaper. He was new to the job, and he took this as a chance to show his leadership. So the next slide, please. So we immediately wondered in the tobacco education program and coalition, can we make a connection to this news story to TRL? And so we called our friends at both the center and TALC and asked for their advice, and they thought we could. And so with using their advice, we made a couple different arguments. The first was that TRL provides funding for increased police presence. In other words, it provides funding for the police to go out and do decoy operations to see if they sell tobacco to minors. And while they're out in the community, there's more eyes and ears, just like what happened in Watsonville. And the other one is with TRL, you can also have a plug-in to enforce the state drug paraphernalia law. So the next slide, please. So we called up our contact at the local newspaper, and we pitched them this connection between TRL and the weapon and drug seizure. And they got it right away. And they immediately wrote an article saying that the stings lead momentum to tobacco licensing. They also wrote an editorial in support of it, and they printed an op-ed from one of our coalition members. So the next slide, please. And then the community really spoke out about this, both our coalition and other community members. Our coalition wrote a letter to the Watsonville City Council pitching the connection between TRL and the drug paraphernalia and weapons. And lots of people spoke at the next City Council meeting, including our coalition. We had about 10 speakers, including youth who did the Youth Access Survey, the Planning Commissioner I talked to you about earlier. And Watsonville City Council clearly felt pressure to do something about these stores and talked about it during the discussion at the City Council meeting. And basically TRL was a way to show that they cared. So they directed the Watsonville Police Department to study TRL and to come back with a proposed ordinance. The next slide, please. And so that's exactly what happened. Was in August of 2010, Watsonville became the first city in our county to adopt TRL. And the police department in their staff report referenced the weapon and drug seizure as how this all started. They referenced the resulting media attention and the community outcry. So next slide, please. So, and their ordinance included a drug paraphernalia provision. So basically what happens is when a store wants to sell tobacco, they need to sign a statement saying that they will not sell drug paraphernalia. Next slide. And this basically resulted in a snowball effect. The other cities and jurisdictions didn't want to be left behind. Watsonville was seen as a leader, and it kind of caught them off guard because they saw themselves as the leaders in the county. So both the mayor in Capitola and the mayor in the city of Santa Cruz directed their staff to research TRL. And we have a group called the City Select Committee made of mayors and the board supervisor and their head staff, and they immediately put it on their agenda. Next slide, please. Around the same time that Watsonville passed TRL, the coalition repeated their youth access survey and found that the sales rate increased by 60% between 2008 and 2010. And the difference in the media coverage was dramatic. It was front page, large graphic, large headline. And once again, it ties it to the tobacco retail licensing on the front page. Next slide, please. So where are we now? So the Board of Supervisors followed Watsonville's lead and passed TRL in April of 2011, and they included the drug paraphernalia provision. That was one thing we found very interesting, is that all the jurisdictions want to be very consistent in their language, so we wouldn't be surprised if any other jurisdictions pass TRL that they also will include this. And we expect the City of Santa Cruz and Capitola to consider it next. Next slide, please. So in summary, the Watsonville City Council became interested in TRL because of other issues in the community such as drugs, weapons, and gangs. TRL and the drug paraphernalia plug-in gave the city a tool to address other issues, and it resulted in momentum countywide for TRL. So thank you.
Thank you so much, Natasha, and thank you for being flexible and jumping in there. So I'm going to back up, and hopefully we can now hear Justin.
Can you hear me?
Yes, we can.
Yay! All right.
So why don't you, I tried to back up to your slide, but why don't you go ahead and control it?
I'll do it. I got it. Yeah. Okay. Sorry, everybody, for the technical problems. I don't know what happened there, but I'm glad you can hear me now. And we're just going to back up a little bit. And so similar to what Jeannie did with the eligibility plugins, for these requirement and prohibition plugins, I want to talk about the public support levels that we know of, where the policies have been passed in California, and how to implement them into your tobacco licensing campaign. So the first up, we're going to talk about the drug paraphernalia plugin, which is Catherine covered, is a tool for allowing suspension of a license for violating state drug paraphernalia laws. And in the survey that Jeannie detailed from earlier in 2011, where we pulled in all these plugins, we see that there is really strong support for this plugin in California. 2/3 of California voters support this plugin, and we can actually even go a little deeper with these results. Fortunately, we can show that there's support for this plugin in both urban and rural areas in the state. So with the survey from this year, we did some oversampling in 2 counties, in Los Angeles County and Santa Clara County. So we have separate results for those 2 counties, and so we see that in urban areas, this plugin also has really strong support. Again, 60, 70% support there. And then we did a survey of rural California voters back in 2008. And for that survey, we also see the great strong support for this drug paraphernalia plugin. So all parts of the state are in support of this plugin. For more information about this rural survey, we did it in 2008. We only included counties that are considered rural, and within those counties we excluded everyone that lives in a town or a city with a population more than 25,000. So we really got at the rural and small town voters in the state. And we found, strong support for licensing, which a lot of people think that might not be supportive of licensing and requirements on businesses in those parts of the state. But there is strong support for that and for this drug paraphernalia plugin. And we have fact sheets and things on that poll on our website. So then for making this plugin part of your campaign, it's probably most relevant for communities that are having a meth issue. Some communities in California are really struggling with meth problems, and if your community is one of them, this is a great way to address that issue and tobacco control issues at the same time. To help you determine kind of the extent of the meth issue in your community or drug paraphernalia, as you do observation surveys in stores, what you can do is you can include information about if these drug paraphernalia products are sold, how often they're sold, how many stores they're sold in, and then making this policy part of your campaign efforts, the first real connection to make is this is an additional tool for local law enforcement. Local law enforcement is struggling with the meth issue. They can't enforce the state drug paraphernalia law, and so this gives them an option to do something about it with the suspension of a tobacco retail license. So, encourage you to talk to law enforcement about these provisions and the advantages that it brings, and that this is really a great way to highlight the usefulness of this plugin. And then really it also lets you connect to the bigger health issues in your community. Back to that rural survey from 2008, 88% of the respondents felt that reducing teen access to meth, teen use of meth was a major issue that government should address, compared to 75% who thought that reducing youth smoking should be a top priority. So you see that the meth issue has even stronger support, and so licensing and this plugin for drug paraphernalia allows it to connect to those issues, and with that, connecting to that issue, it opens up doors to other groups. So new partnerships for drug and alcohol coalitions. You can go to their coalition meetings, invite them to your coalition meetings, set up one-to-one meetings with them and talk to them about this plugin and tobacco licensing in general. It really helps you get engaged with those groups. Often those groups are influential in the community and can help you do more and further your efforts in your campaign to get a licensing ordinance passed. And to go into detail even more about this, we partnered with TALC and created a fact sheet on the drug paraphernalia plugin, how to use it, what it is, how to use it as part of your campaign. So that's on both of our websites if you want more information on that. And then within California, there are 9 cities or counties that have adopted some form of the plugin for drug paraphernalia, and similar to the poll results, we see that it's in all different parts of the state. We have urban cities like Oakland and Richmond, but there's also rural cities in the Central Valley like Firebaugh and Riverbank that have done a drug paraphernalia plugin. So it's a good plugin that really can help address key public health issues in all parts of the state. And not all the plugins are the exact model language from TALC, but they do some sort of allowing suspension for sales of drug paraphernalia. So the next plugin I want to talk about is eliminating sales of individual little cigars or cigarillos. There's something that's new that TALC's going to come out with the plugin shortly, the actual model language. But I want to look at the poll results, and we see a majority support, not the same level of support as the drug paraphernalia provision, but a majority of voters would be supportive of eliminating single sales of little cigars. In Los Angeles County, we have the separate results for that county, and we see that the support's a little bit stronger at 56%. But in addition to the overall support, the main thing, we also ask pro and con arguments. So these pro and con arguments show that there's room to educate on this issue, and that if you can do this education, you're probably going to increase your support levels for this provision. So the pro arguments we asked about are, is a good reason to support this policy is because they're marketed towards youth and they're inexpensive, and so eliminating single sales will help reduce youth smoking. 70% thought that was a good reason to support the policy. 65% thought a good reason would be that prohibiting these single sales would reduce smoking rates among African Americans and Latinos, since the products are marketed primarily to those groups. And then compared to the con arguments, the pro arguments were much stronger. So the con arguments were that it creates a needless hassle for the consumer to have to buy them in packs, and that it's wrong for the government to tell retailers how to sell certain products. And those only each had 50% that thought it was a good reason. So the pro arguments are definitely stronger and show that with more education on this issue, the levels of support for the plug-in can certainly grow. These poll results also help identify, the best arguments for this type of policy and the type of partnerships it could create for your campaign. So these products are primarily marketed and used by, are marketed to and used by youth and African Americans, and so the messaging should be around protecting these groups from the dangers of tobacco products. Use of these products is on the rise in recent years because they are now an inexpensive option to buy in a full pack of cigarettes. The FDA law that we mentioned earlier prohibits flavored cigarettes except for menthol cigarettes, and so, but it doesn't do anything about flavored little cigars or cigarillos. So there can still be, chocolate flavors or cherry flavors that appeal to youth, and they're not only do they come in flavors, but they're cheaper than cigarettes, and so, the use of these products is probably going to continue to be on the rise among those groups. Certainly as you do observation surveys in stores, this is something where you can look at these and see how often they're being sold and where they're being sold, what types of stores, what price they're going for, things like that. And actually recent youth purchase surveys in Los Angeles County have shown that these products are sold to minors more often than cigarettes. So when you have your minor decoys go in and they ask for little cigars or cigarillos instead of Marlboros, the retailers are selling them the products at a higher rate. So that's pretty significant, and maybe that's something you could do in your community to see if that's a problem there as well. So in building a campaign and partnering with youth groups, you want to think about youth groups, groups that work with African American community or other types of groups focused on the health of specific populations. Partner with them, invite them to your coalition meetings, show them how these products are impacting the groups that they serve. Remind them that eliminating the single sales will bring it in line with the cigarette law, that they have to be sold in packs. And many of you are already working with some of these groups on menthol resolutions, so you're building great relations there, and this is a way to continue that relationship and make an impact on another product that's being targeted at their community. However, in California, none of these this plugin hasn't been adopted in any communities so far, but there are a couple cities in Los Angeles County that are beginning to work on it, so that may happen soon. But a similar policy has been adopted in a couple of cities and counties in Maryland. So for the last three plugins that Catherine covered, the signage one, the age-specific laws one, and the tobacco lookalike products one, we don't have polling data, and there are limited examples in California, but they really serve to illustrate the value of these plug-in provisions. They help you build support for licensing efforts, they help you address other tobacco control issues, and tie it into other public health issues in the community. So it's a really good tool that you can build new partnerships with. So for example, with the signage violation provision and the age verification, you're connecting to the alcohol issue, so new partnerships with law enforcement or drug and alcohol coalitions. Santa Clara County has adopted a signage plug-in that limits all advertising to no more than 15% of the storefront window space. So this limits not only tobacco advertising, but alcohol or any other type of advertising at those stores that sell tobacco products. In Gilroy, they're working on the age-specific plug-in because they're working with the Drug and Alcohol Coalition, and that issue was important to them. So they care about tobacco and the other drug and alcohol issues. And then they can also help you respond directly to concerns that you hear about from residents in your community. I've heard about the example of a resident that complained about a big brand new tobacco ad at a store, and the signage plug-in creates some way to address that. I've received a lot of calls about candy cigarettes and other tobacco lookalike products and wondering why those are still legal to sell. So, the plug-in again is a way to address that. There are no cities or counties that have yet adopted that tobacco lookalike plug-in, but it certainly is a way to be responsive to concerns that you hear from the community. So overall, these plugins are great tools to help advance your campaign and get you here to the City Council, build new partnerships, and address other public health issues in partnership with important tobacco control issues. Here's all our contact information for the center. And instead of turning it over to Natasha now, I will give it back to Leslie for questions and answers.
Thank you so much, Justin. Do you mind advancing it to the last slide, which has contact info for both the center and PHLP? So we have a lot of great questions.
Up on the Q&A.
Yeah, great. So we're going to start off with the first question. I'm going to direct it to either Justin or Jeannie. Elected officials are very concerned with the impact on business. Do you have any data that shows there's minimal impact on business, or how have you addressed this question when it's come up?
I can start, and then if anyone else wants to jump in, feel free. You know, if the business is following the law, it's not going to impact their business at all. You know, this is really all about retailers that are breaking the law and selling tobacco products to minors, and if they break the law, there's the appropriate punishment. We have a fact sheet on our website that shows how much the average convenience store makes from sales of tobacco products. So it takes data from the National Convenience Store Industry Group, their annual report, and shows that they make, I don't remember the exact number off the top of my head, but somewhere in the neighborhood of 400 or 500,000 a year in tobacco product sales. That's actually just cigarette sales. So they make a lot of money off these products, and so a licensing fee is such a small fraction, it doesn't hurt their business at all. It's an appropriate fee to fund enforcement of the laws and ensure that they're following the laws.
Thanks, Justin. Does anyone else have anything they want to add to that? So Ian, I'm going to ask the next question of you. There was a question about whether tobacco retailer licensing could be used to require a minimum sales price or to ban coupon redemption or other price discounts.
Sure, thanks, Leslie. That's a great question and a very hot topic these days. What can we do about retail price manipulation that's really artificially lowering the cost of tobacco and thwarting the effect of tobacco taxes? The short answer is yes. Licensing is a great mechanism to enforce any type of law, essentially, that applies to tobacco products, including a minimum price law or restrictions on price discounting or coupon redemption. But a couple of things that I do want to note. One is that you can't enforce anything through a licensing ordinance that is not legal to enforce directly. So right now at PHLP we have started doing a lot of research that we'll be wrapping up soon on what can we do about price discounting and coupon redemption and minimum price. It's a complicated area, and we want to make sure that we're on strong legal ground before we start providing TA to California communities on this. It looks very promising, but I just want to underscore that we have to make sure that we can pursue some of those policies directly before we incorporate them into TRL, but it would be a good way to enforce them. The second issue is that we really have been talking about local licensing ordinances during this webinar, and anything that you enforce through a local licensing ordinance will only apply where your local ordinance applies, namely the city or the county. So, you know, is it a good idea to implement minimum price just in the city and county? Maybe that's maybe for a different call, but just keep in mind that you can only enforce those conditions where the TRL is also enforceable.
Great. Thank you so much, Ian. So we had a question about hookah lounges. If anyone has information about using tobacco retailer licensing to address hookah lounges, because in California they often fall under the exemption for tobacco shops, which means that they can allow smoking inside. Does anyone have a comment on that?
Can you repeat the question?
This is Justin.
Oh, go ahead, Justin. This is John. I'll wait.
Yeah. I mean, I'm aware of a couple of cities that have banned hookah lounges or that have prohibited new ones, but I don't know if any that have done it through a licensing ordinance. I don't know if Ian can comment on how you would do that or if you can do that.
Yeah, I'll add one thing really briefly, sorry Don, is just to piggyback on Justin's point, is we do have a plugin that we have model language for that would prohibit a license for any business that allows smoking of anything on premises. So the business would have to effectively choose, do I want to take advantage of the loopholes in the state labor code and allow smoking on premises, or do I want to sell tobacco? Because if you adopted that plugin, then you could not do both.
And this is Dawn, and in our county, I don't see a loophole in, and we don't see a loophole in the state law or in our local laws about smoking inside. If you are a restaurant, unless they are a significant tobacco retailer, but if they are serving food and beverage inside, they are a restaurant bar, and I don't care how much hookah they're selling, they would be considered, you can't be a little bit pregnant, so to speak. None of the restaurant and bars in our state may allow smoking, neither can they. And that's what our DA's take has been. And they would be subject to our outdoor air laws too. And on many of our South County communities, they have restrictions on patios. We have a lot of universities. 10% of my entire population is in a higher learning institution. And we've been able to keep a lot of these venues from coming to town. And of course, sales of hookah tobacco is covered in all of our TRL laws.
Great. Thanks, Dawn. Well, we are exactly at time, so I want to honor that commitment. The last slide shows how you can reach out to us directly. If any of your questions didn't get answered, or if you have more specific questions that you want to follow up with us, please feel free to contact us at the information that you see on your screen. Also, when you leave the webinar, you'll be directed to an evaluation survey. If that doesn't happen, or if you don't have time to fill it out now, you'll also get an email later today or tomorrow with information about how to fill out the evaluation and also where you can access the webinar recording on our website. So again, I want to thank all of our presenters for this fabulous information and all of our participants for listening in.